Hi, this is Cheryl Sutcliffe, the BCMA coordinator at Phoenix VA Healthcare System. This video is the documentation of acute coronary syndrome, venous thromboembolism, and atrial fibrillation heparin drip protocols using UFH anti-10A monitoring. Here is the heparin drip order with an indication for venous thromboembolism using UFH anti-10A monitoring. Let's start by scanning the patient's wristband. Ensure correct patient identification using two patient identifiers. To initiate the heparin drip, scan the heparin bag. Click OK. Choose your IV site and click OK. A box pops up for the second nurse verifier. The second nurse verifier enters his or her access code and verify code after independently reviewing the heparin order and hit OK. You will see the infusing bag is hanging, but there is no documentation as to how much bolus is given if ever there is a bolus ordered, as well as what was the initial infusion rate. To document this, right-click on the infusing bag, add a comment, a dialog box pops up, scan the QR code for the initial infusion using the UFH anti-10A monitoring. Fill in the blanks fields such as the bolus dose if there is a bolus dose ordered, the infusion initiation rate, and the UFH lab draw. If you don't remember what was the order, you can scroll over this display. So our initial bolus dose would be 8,740 units, and the initial infusion rate will be 2,000 units. So initial bolus is 8,740 units, and the infusion rate would be 2,000 units per hour. And UFH anti-10A order will be on at 11/11/2024 at 0800. Click OK, and your documentation appears. If the UFH result does not require a bolus order, please write 0 on the bolus dose section. For any dose adjustment or titration, the Joint Commission recommends a need for a second nurse verifier. To document this, let's pretend that the UFH came back at less than 0.1 seconds. So right-click on the infusing bag and take action on bag. Choose Stopped, and on the dialog box, scan the QR code for per BCMA guidelines. According to this BCMA guideline, you are not really stopping the bag in the LRS pump. You are stopping it here in BCMA so that the second nurse verifier box will pop up. Click OK. Go back to the stop bag and right-click and choose Take Action on bag. Choose Infusing, and in the dialog box, scan the QR code for UFH below therapeutic level. Fill in the blank fields, such as the UFH result, the bolus dose, if ever there is a dose ordered, and the new rate, as well as the UFH lab draw. So we said our PTT result was less than zero point 0.1 seconds. If we hover to this display, we look at the titration for less than zero point 0.1 seconds. We're going to give a heparin bolus of 8,740 units. However, if your UFH result does not require a bolus dose, you can just put 0 in this section. So we said we will increase the rate by 580 units. So from 2,000 units, we're going to add 580 units. So that would be 2,580 units. Our UFH anti-10A will be ordered today at 1,500. Click OK. The box pops up for second nurse verifier. The second nurse verifier enters his or her verify code, access code, and verify code after independently reviewing the heparin order. Click OK. If you hover to the infusing bag, you will see your complete documentation. If the UFH level is therapeutic, that is a UFH of zero point 0.3 to zero point 0.7, there will be no changes to the heparin drip. So you don't necessarily need a second nurse verifier. However, you still need to document the UFH result and the next UFH lab draw. To document for therapeutic levels, let's pretend that the UFH result came back at zero point 0.5 seconds. So right-click on the infusing bag, to add a comment, and in the dialog box, scan the QR code corresponding the UFH therapeutic level. Fill in the blank fields. So we said our UFH result is zero point 0.5 seconds. There's no bolus, no changes. UFH anti-10A will be ordered today at 2200. Click OK. That's your documentation. Notice that we did not have a box pop up for second nurse verifier. That is because we did not make any changes to our dose or rate. Let's pretend that the next UFH result came back at greater than 1.1 seconds, which is above the therapeutic levels. This protocol states to hold the drip for 1 hour and decrease the rate. Since we will be needing a second nurse verifier because there will be a change in the dose, we need to stop and start the bag in BCMA. To document this, right-click on the infusing bag, take action on bag, choose Stopped, and in the dialog box, document per VTE protocol because the protocol states to hold if the UFH is greater than 1.1 seconds. Click OK. Ensure that you stop the Larry's pump for 1 hour and set your timer for an hour. After an hour, restart the heparin drip by going back to the stop bag, right-click and take action on bag. Choose infusing, and in the dialog box, scan the QR code for UFH above therapeutic level. and fill in the blank fields. So we said our UFH result is greater than 1.1 seconds. We held the drip for 1 hour. Then we're going to decrease the rate. So let's go to titration above 1.1. So we held it for an hour. We will resume but decrease the rate from previous by 290 units. So from our previous rate of 2,580 units minus 290 units, this goes down to 2,290 units per hour. Then your next UFH lab draw will be the following day. At 0500. Click OK. The box pops up for the second nurse verifier. The second nurse verifier enters his or her access code and verify code. Click OK. If you hover on the infusing bag, you will see your complete documentation. So we stopped it because the protocol says we have to stop it for an hour. And this is your complete documentation. If the UFH result did not require holding the drip for an hour, please delete the verbiage heparin drip held for 1 hour. Ensure that you restarted the heparin drip in the Alaris pump. The second nurse verifier should perform an independent review of the heparin drip order, especially if it involves dose adjustment. At every dose changes or titration, ensure that you order the UFH lab draw per protocol and as indicated. This concludes the presentation for documenting the VTE protocol using UFH monitoring. Before I end this video, I would just like to emphasize some key points for documentation. Use add a comment when initiating scanning a new bag. If the PTT or the UFH result is therapeutic level, use take action on bag when stopping and infusing the bag to bring up the box for the second nurse verifier. Use per BCMA guideline QR code when stopping the bag in BCMA to bring up the box for the second nurse verifier due to a change in dose or rate. And lastly, write per ACS or VTE or AFib or low dose high dose protocol when holding the drip for 1 hour because the PTD or the UFH is above the therapeutic level for that specific protocol. Thank you.